Today we are going to look at how public health has extended our life expectancy. We talked about last time how it's added about 30 years to our life expectancy, and today we're going to look at why and how. Okay. Um, there are three basic core functions um, designed for public health: assessment, policy development, and assurance. Okay. Then public health. Um, developed 10 essential services out of those three: assessment, policy development, and assurance. Some of the essential services for public health are to monitor the health status, to identify and solve some community health problems. Okay. Um, they also diagnose and investigate health problems and health hazards in the community. So if they are noticing that suddenly a big city has a whole lot of lung issues that are going on, okay, then they might investigate how that new factory that came into town might have something to do with it, okay. They inform, educate, and empower, okay. This has never been more evident than right now, okay. Public health is informing, educating, and empowering people with everything that's going on with coronavirus. Sometimes I think it's not necessarily the truth, or maybe it gets misconstrued as it comes out to the public, but nonetheless, they're informing and educating us, okay, about the current health issues. They're going to mobilize community partnerships, okay, so they're going to look at ways that one business can help the general public, or one business can help another business, okay. This has been huge, 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 huge right now in people helping out the hospitals, okay, whether it is GM producing ventilators, or other companies that never have made face shields, but they've closed down production of whatever they normally make, and they're making face shields for hospital workers, or the schools. I know that Mr. Craig and Carlos, Carlos is the big CEO at the hospital. They talked about whether we had some healthcare supplies here at the high school that we could donate to the cause. Okay, I know we took some gloves and gauze, alcohol pads, and things like that to donate to the cause. Okay, we're obviously not using them here at the school, so we're donating to the community in that way. We also, I think most people have heard, but maybe not, the oh, you'll YNG, that business, that 3D printing business. They're behind Jordan's. They were getting lots and lots of calls, and they wanted to help make like bands to for healthcare workers. We have masks that loop around, and they can create sores on your ears, and so they started making bands to take that pressure off people's ears, and they made face shields and all kinds of other things, but they didn't have enough capability at YNG to keep up with it. So our CHS took our 3D printer out there, and they're using it for the time being, not being used here at the school. So that way it's getting some use, and we're helping out the community. Awesome, awesome things that are going on. Develop policies and plans that support individual and community health efforts. Okay. Enforcing laws and regulations, okay, that protect the health and ensure safety. There are lots and lots, OSHA and other organizations that work on that, protecting employees, which in turn protects the health of everyone else in the community. If you look at, and I'm sure you've heard about the meatpacking plants in Logansport, okay, they are like a major hotspot right now because there's so many people that work there, and then they took it home to their families. Okay, so all those safety regulations, those laws are helping to reduce all that. The public health also links people to needed services and assure care. So they're making sure that people are getting the care that they need that might otherwise be unavailable. Okay. Assure a competent workforce. It doesn't matter how many nurses and doctors we have in a facility if they're not competent. Okay. So, public health outlines different guidelines for making sure that people have their license, their certification. I have to turn in my certification and my license every single time to my employer. They put it in a permanent file, and then the state comes in and looks through it and says, "Oh, I don't have a current license for Ashley Webb. Why is she still working here?" Or whatever. Those kinds of things also help with our public health. And there's two more, and the others are evaluate health services. Okay, so um, the Public Health Servants Department of Health for the state of Indiana, they come in and and assess how we're doing things, making sure that we are being effective, we're being safe, we're keeping up with the safety policies and procedures. And then they research to find new and innovative ways to solve health problems. We talked about those three core values and um, the core functions of assessment, policy development, and assurance. And you can see all those things that we just went through, the 10 essential services, how they fit into one, or sometimes even they kind of fit into two of the core functions. Okay, so when we're looking at assessment, we're looking at surveying and disease investigations. Okay, investigating to see what health issues are affecting our community or our state. Okay, then they educate and empower and develop policies, and they educate us about those policies. Okay, and then when they are surveying work sites and checking for licenses, all that is assuring that these policies that we've set in place are actually working, that they're actually doing what they're supposed to be doing. Then we're going to get into the structure of public health in the US. Okay, obviously we have federal agencies that work for public health, and then we have state, and then we have local behind that. Okay, some of the, I'm losing my papers here. Some of the federal responsibilities. Okay, so when we're looking at, sorry. I'm not sure what happened to that paper. When we're looking at the framework for improving public health, we're looking at the health department, community partners, the workforce. That builds on then into our structure, our infrastructure for public health, which then impacts every community program and every public health activity, which then in turn we have better health outcomes, and we're prepared better. Okay. A lot of people would argue that we weren't prepared for this. Okay. And kind of playing the positive side of that, I don't know how you could prepare for something like this. I mean, essentially, there's always talk of pandemics and all this kind of stuff, but for as wide scale as it got as quickly, I think we've actually, in my opinion, we've done a pretty decent job, but we're certainly not living in a hot spot. Okay, then we're going to look at roles and responsibilities of the public health and the federal public health. Okay, ensures that all levels of government have the ability to provide all those essential services. Okay, making sure that they have everything set up and they're able to do that. They need to act when health threats span more than one state. Okay, so we have um, uh, some sort of outbreak here in Indiana, but it stays in Indiana, then it's not the federal public health agency's responsibility. It's Indiana's. Okay, so when it spans more than one state, which is exactly what's going on right now, then the federal public health gets involved. Um, it will act when there are solutions that go beyond the individual states. Okay, if we need, in this case, if it was just in Indiana, and if we didn't shut down the surrounding states, then it's going to quickly escalate out of the state, especially like the time that it happened, because everybody, me included, were wanting to get the heck out of Indiana, right? So if they hadn't, shut down some other states, if they hadn't, the federal government hadn't stepped in, then we would have been here in Indiana, and we would have said, well, there's nothing going on in Florida, so we're going to go ahead and go to Florida. Well, on the way to Florida, we stop in Kentucky for gas, and we stop in Tennessee, and we stop in Georgia, and then we're finally to Florida. Look at all those people we could have spread this to in the meantime. Okay, that's pretending that it was just in Indiana. Obviously, it was not in Indiana. It was nationwide. So the federal government took over for that reason. But if it had just been in Indiana, the federal government could have taken over because the solution was to shut things down. Okay. They work to assist states when there's some sort of public health emergency. Okay, whether it's a natural disaster, some sort of disease. We know that that's true, that they stepped in to assist the states to make sure that we had everything right now. And then they form different goals for the public health. Okay, some other roles, they provide leadership in setting goals, policies, and standards. Okay, so we have the goals of trying to, for a lack of, or hearing it a million times, flatten the curve. Okay, so that's our goal. That's why we set all these stay-at-home orders and those kinds of things, so we could accomplish our goal of squashing that curve, so that we could drag it out longer, so that hospitals wouldn't be overrun, so that everybody that needed a ventilator could get a ventilator. Okay, they help with providing resources, whether they're financial resources or operational, which operational would be equipment that we need, supplies that we need. Okay. As we know, when this all first kind of blew up, we didn't have many ventilators. Okay. And then the federal government helped, and some big companies helped. And now we have lots and lots of generators, ventilators, it's sitting and waiting, that hopefully they won't need to be used. But if they need to be used, we've got the supplies, we've got the resources ready to go. Financing research and higher education. Okay. And then supporting the development of tools to improve the health, okay, at all levels. Then looking at the state, okay, this gets a little bit more specific, but some roles that the state plays: screening for diseases and conditions, treatment of diseases, assistance and training, laboratory services, and epidemiology and surveillance. Okay, so basically, screening for diseases, seeing what things are affecting our state. Okay, because whatever's happening in California doesn't necessarily mean that it's going to happen in Indiana. Okay, so they've honed that down, and so just the smaller local governments are working on those kinds of things. Treating diseases. State laboratory services. This has been a big one right now, because initially when this started, we didn't have enough tests. We didn't have enough tests to test the people that needed to be tested. Okay. Then we got enough tests, but then what did we have? We didn't have enough laboratory services that could properly process the test. Okay. Now you'll see, if you've watched the numbers, and I am guilty of not watching the numbers lately, because kind of over all of it. I have heard some of these key phrases and numbers, and they're being twisted around and all those kinds of things so much that I kind of stepped back from it for a while because it was just kind of driving me crazy. But if you'll see in the last few weeks, our numbers have gone way high. Do I think that there's a whole lot more people that are sick? Maybe, maybe not. But I think the bigger thing is that we have more tests and we have more capability to process the test. So if we're offering more tests and giving more tests, that number, we're going to get more positives. They're going to raise up. Okay. Now, of course, the thing that's going on in Cass County is a whole different ball game. Okay. But all those workers working in close vicinity, and then a lot of them living together or living in big homes with several families, it's going to spread like crazy. But for the most part, I think that biggest jump that we've seen recently is because we have more tests. Okay. We're giving out more tests, and we are processing more tests. Okay. As far as at the hospital, I know that we have done a lot of tests in our drive-through testing facility, but we have not had many positives. Okay. So if you look at the numbers, and I encourage you to look at the numbers, look at the number of people that have been tested, and then look at the positives. Okay. So lots and lots of people have enough symptoms that we think they need tested, and they're not coming back as positive. Okay. Which I think is encouraging. This is a little bit of an interesting thing. If we're looking at the funding, okay, for the state, look at the biggest percentage of it that comes from federal funds, and then a big chunk comes from general funds, and then we've got smaller things like fines, Medicare and Medicaid, and other things like that. Okay, then we're going to get into localized health department, more Jasper County, more right here. Okay, some of those roles are monitoring immunizations for adults, okay, um, looking at communicable diseases, okay, telling um, um, whether diseases are spreading through the community. Okay, this is one where I know as the athletic trainer and working closely with the school nurse, we have to um, let the health state or Jasper County Health Department know when we have communicable diseases. Okay, if you remember back, I think it was in January, I can't remember for sure, when we had those 2 days off school for the flu. Every single day leading up to that decision, when we decided to close, Mrs. Redland had to call the health department and say, okay, we've got this many students out of the high school, this many out of the middle school. That's where those percentages came from, and those numbers came from that let us know when we needed to close, because we got to a certain percentage of our total population. Okay, so kind of watching those communicable diseases is a huge thing. Several years ago now, we had a parent that was going around, an athlete's mom that was going around telling coaches, athletes, parents, students, anyone that would listen, that we had a major outbreak of MRSA. Okay. So much, she was talking so much in the community that the local health department gave me a call. Never a good day when you get a phone call from the local health department. Okay. That was one of those, oh my gosh, I can't believe this is happening, like panic. It's a good thing it wasn't a video chat. But they called to confirm that. Okay. At the time, we had maybe 2 or 3 cases of ringworm, maybe a case of impetigo, but not a single case of MRSA. Okay. So in this case, the health department called me. I denied everything because it simply wasn't true, these rumors, and then we moved on. Okay. They monitor immunizations for children. Okay. That's why Mrs. Redland has such a close eye on what immunizations you guys have had, because we have to report it to the health department because they watch out for all that. We certainly don't need an outbreak of the measles or the mumps because people haven't gotten their immunizations. Okay. looking at tuberculosis screening, food service establishment. Okay, so the health department goes around and they observe to make sure that you're washing your dishes at the right temperature. Make sure you're storing the chicken at the right temperature. Make sure you're cooking the chicken to the right temperature. Make sure that you're not using the same cutting boards to cut up produce as you are meat. Okay, all those things are in food service establishment inspection. Environmental health surveillance. Okay, so many times in the summer we get phone calls or we get health notifications that it's going to be super hot and we need to watch for heat illness and those kinds of things. That's all part of the local health department. It doesn't do us any good for Southern Indiana to contact us about a heat wave that they're having down there. We may have had a storm roll through up here, and it's 20 degrees cooler up here than it is in Southern Indiana. Food safety education. Of course, they're always telling us about, the food pyramid and eating the right fruits and vegetables and all those sorts of things. Okay. Schools and daycare inspection. So to have a daycare, you can't just open up a daycare and say, I'm going to have a daycare. You have to have the local health department come in. They need to know how many students or children you're taking care of based on how many adults that are there. There's certain numbers, ratios there that you have to have. They have to make sure that you have a fire plan and all kinds of things for daycare. Okay, that's all we're going to cover for public health. There's a life expectancy activity that I would like you to complete just for fun, just to see where we're at and which ones of us are going to live the longest. I haven't done it yet, but I'm going to do it this afternoon. And then we're going to wrap up public health and move on. Okay, let me know if you have any questions, any problems. I miss you guys, and I hope that we can get together real soon.